Hi, I'm Dr. David Warwick, your local Lacey, Olympia chiropractor. We're going to be reviewing with the patient an old injury that she had, and that chiropractic can still work with old injuries, including fractures. She was explaining to me that she had a fracture that was toward the close area, toward the top shoulder right here. Many times those old fractures are actually more solid and more secure than, or safe in that area than even the areas around it because of the type of bone or calcification that lays down on there. A lot of times if people feel or experiencing pain after an old break or an old injury, it means that the joint isn't moving properly or as well as it could be, and there's like 7 portions to the shoulder joints that can affect it, all the way from the chest bone and in the clavicle area, the humerus, back with the scapula even. So I'm going to go through and do some checks on her to see, can I move the arm like this? I want to place my hand right on the clavicle bone that's in the center of the chest. I'm feeling for motion or movement there. As the arm raises up, I can feel some of that engaging. Any pain or tenderness there?
Just a little bit where it's sore.
Right there. No recent injuries. So I'm going to go at the far end of the clavicle. I'm checking for motion there. I'm also checking to see how it tracks, and a little bit of loss of motion right there. So I'm going to have you actually scoot down a little bit on the table, right there. A little bit more. And I'm going to use this piece here as a drop piece to help adjust that area. And I'm going to go real easy. So the shoulder blade is, or the shoulder actually joint is starting to open up. I can feel that in there. And we're going to just assist it as I'm going to gradually add pressure to it. Are you okay?
Mm-hmm.
Do you want me to go lighter?
Yep, you're good.
Okay, so my hand's on the shoulder, right in the joint there. There we go. Good. Yeah, it does. As soon as we did that, let it hang. Can you let the other one go like that? Now I'm going to go a little bit lighter here. So I'm going to lighten the pressure. My hand's going on the shoulder, again through the armpit. I'm going to tighten it up a little bit more. Good. Now we're going to end up checking for motion in a circular direction for her. And right through here. Pretty good. Gentle traction through here. Hand right at the arm. Traction down. Good. I'm going to have you go ahead, lay face down for me. And we're also going to drop that piece down. So on the last video, I ended up adjusting the T1 rib through here. Good. It's hard to communicate sometimes what you're feeling in there, but a lot of times the muscles will be really tight through there. There'll be restriction or motion through there. Lots of tenderness on the various muscle groups in there. But by contacting that, adding some pressure, and helping correct that in the appropriate direction, bringing the blade back just a little bit here. And now I'm going to begin checking some more of the ribs right through here. I need you to move footward on the table, so move down a little bit, right there. Perfect.
That better?
Yep. Good, and let the arms go right to the floor. A gentle traction. Good. Table will drop right through here. So actually my hand's contacting the rib heads. Good. Okay, so we're going to recheck in the sitting position. Let's go ahead, have you sit and face the windows.
Okay.
So if you're suffering with shoulder pain toward the chest area or arm pain right through here, good to get checked by a chiropractor. I'm going to check again, check the motion of the shoulder blade going backward. We're going to bend the elbow here. Drop your head down. Good. Just a light little impulse in there. Good job.
Go ahead and move the arm around, see if that feels a little bit better.
Yeah, the pain was actually like right in the back, so that seems to be better right now.
Let's see how long that holds. You let me know.
Okay.
All right, thank you. I'm Dr. David Warwick, your local Lacey Olympia chiropractor.